I'm Tamara Thomas, editor-in-chief of UrbanHealthToday.com, part of the DocWire family of medical news sites, and I want to thank you for tuning in to Urban Health Weekly. Our goal each week is to keep you informed of the latest in health and medical news right from today's headlines. It's time to empower yourself with open conversations about your medical care with news that matters to you. So are you ready? Let's get started. Hi, I'm Tamara Thomas, editor-in-chief of Urban Health Today, and I'm speaking with Dr. Lauren Powell, Vice President of U.S. Health Equity and Community Wellness at Takeda Pharmaceutical. She's here to talk about remote area medical and Takeda's partnership to support free pop-up medical clinics across the country, advancing health equity. Thanks for being here with me today, Dr. Powell.
Thank you so much for having me, Tamara.
Awesome, let's get started. So can you talk about remote area medical, then about your role at Takeda?
Sure. So excited, one, about joining you today, and two, about my role at Takeda and about this partnership. So first, let me tell you a little bit about RAM. RAM stands for Remote Area Medical. This is a national nonprofit that serves lots of communities across the country. They provide high quality healthcare across rural and underserved populations where it's needed the most. So they do pop-up health clinics in some of our country's most impoverished areas, oftentimes in rural areas, sometimes in urban areas. And that means they're providing both medical care, dental care as well to folks who would not have access to it otherwise. They do somewhere around 300 of those pop-up health clinics in a year. And so we're so excited to be supporting their activities, as well as finding ways for our Takeda employees to support their ongoing clinics. And a little bit about myself and my role. I am the Vice President of U.S. Health Equity and Community Wellness at Takeda. I'm actually the first in this role. So it's an inaugural role, not only for Takeda, but kind of very new to the industry as well. It's been an incredible and exciting opportunity for me, really dismantling the roots of oppression that keep people and communities from wellness, and achieving health equity is a core passion of mine. It's also the reason why I chose this as a professional path. And as someone with a public health background and having been a former state health official, I'm just excited to bring my talents as well as my expertise and actual lived experience with this to my role at Takeda.
So can you talk about why this partnership is of strategic importance?
Yes, absolutely. This partnership is of so much strategic importance to us, as Takeda is really working on figuring out kind of what is our role to play in advancing health equity. We're not only committed to sort of talking about health equity and raising awareness about it as an important topic and concept, but how do we operationalize our commitment to it? There are things we're doing internally, so ways that we're thinking about how health equity should be an intrinsic driver of how we do our business. But then there's also the external impact. And so really wanting to think about how are we actively contributing to ensuring that diverse communities across the country are receiving the resources that they need, are receiving the care that they need, and that ultimately we're helping to move the needle and pushing them closer to health equity. Working with RAM and supporting the RAM clinics is just a really wonderful way and a salient way for us to do those things, and recognizing that we don't need to reinvent the wheel and perhaps create something from scratch ourselves, that there are so many other organizations out here who already have relationships within community, lots of communities, and who already know how to solve many of the problems that we're thinking about as we talk about health equity. So this was a strategic importance to us, and also, so excitingly to me, offers us the opportunity to actually embed our employees in helping with some of the operations of some of these clinics that RAM operates. And so it's a win-win all around, right? We're helping communities, but we're also challenging ourselves to step outside of sometimes our areas of privilege and step into areas where we see how inequities are impacting people the most.
Can you expand on, you just said that you embed Takeda employees within RAM. Can you expand on that some?
Absolutely. So one of the things that I'm most excited about, outside of supporting the operations of these clinics,
Mhm.
is that we're really challenging ourselves to learn more about health equity as an organization. So we have sort of a learning and development path and ways that we're really wanting to educate our staff on and our employees on what health equity is, what it isn't, the difference between equality versus equity, and the ways in which our decisions and the ways that we do our business have an impact on driving health equity day in and day out. As we extend kind of the learning journey from just learning modules and kind of internal learning, we want a part of that learning journey to connect with actual real world experience and seeing the impacts of health and equities up close and personal. One way we plan on doing that is connecting our employees, our Takeda employees from all over the country, which are located in lots of different places, to volunteer and express volunteerism through the RAM clinics. And so really just taking that learning and development all the way through to on the ground experience where, it's one thing for me to talk about health equity on a PowerPoint slide for you and give you a really sanitized definition. It's another thing for you to actually see how health and equities come to life in our of direct impact on individuals every single day through volunteering in a clinic like this.
And it expands learning too, I imagine, expands worldview,
Absolutely.
how you interact with the world. Yeah, and it takes you out of those privileged spaces so that you can look at something else besides your lived existence. That's beautiful. Um, can you talk about how this partnership helps RAM's mission, just in terms of reach, services, supplies, et cetera?
Absolutely. So with Takeda support, RAM will actually be able to increase the capacity of their clinic operations and expand their services into new communities, which we're really excited about. Um, so they, as I mentioned, they do roughly like 300 or so clinics per year, but our multi-million dollar grant will really help support some of the infrastructure to ensure that they're able to reach additional clinics, and I'm sorry, that their clinics are able to reach additional people, and sometimes even push out into spaces where they have not been yet, and in communities they maybe have not connected with yet. And RAM is really dependent upon private donations of volunteers. So collaborations like this are so critical to their ability to provide for people living in remote areas completely free of charge and with no questions asked. And we know that is such an important an important foundation of health equity as well.
And so let's jump on that. So can you speak about specific challenges people living in remote areas face getting medical and dental care?
Absolutely, Tamara. This is such an important point. Thank you for asking about that. I think oftentimes when we think about health equity, we tend to have just an urban perspective that we're only talking about people living in impoverished conditions, maybe within urban cities. And quite frankly, we often add the labels of just Black and Brown communities just overarchingly to health equity when we use the phrase. In reality, right, health equity certainly applies to ensuring that we're creating the conditions for the most marginalized to receive the best possible care and the best possible health outcomes um, that are available. But it also means that it has implications for all of us, right? One of the areas we really don't think about enough is rural health inequities. We know that rural poverty is very different than urban poverty, that the challenges in rural areas may be similar to urban areas, but with a much different level of impact and implication. So transportation, for example, could be a challenge in both an urban area. So maybe there are bus routes and there are trains, but they don't come close enough to your home. Whereas in rural areas, transportation like just doesn't exist. Public transportation doesn't exist at all, right? The number of rural hospitals that have closed in the past few years and the implications for all of that. We could also think about COVID and the implications for surviving and thriving during COVID and the challenges specifically within rural communities. So we're so excited, and this was actually very intentional, I'll say, as I was thinking about ways for us to really step out and show our initial commitment and true commitment to health equity, how do we really want to do that? And I stepped back and really thought about operationalizing our relationships through the lens of ensuring that we are starting with the most marginalized in mind. So our first two partnerships were with Xavier University of Louisiana, a historically Black college or university located in the Deep South, where we know health inequities are clustered and very significant, often tied to the history of slavery and the implications of just health outcomes as a result of that. And then also in a rural area, in an organization that serves rural patients, because I don't think we talk enough about rural health inequities. And also, I don't think we really consider how diverse rural areas are, right? They're not monolithic. They're not all white. They don't all go for the same political base, right? They're very diverse. And stepping out and really making a strong commitment through the lens of health equity, through the lens of ensuring that we are upholding the most marginalized and those people who have kind of been on the outskirts of society unfairly, especially in our healthcare system, was so important to me and so important for, I think, the long-term vision of our impact on health equity at Takeda.
So part of the partnership, there's a focus on training materials for RAM. Can you talk about that?
Yes.
What does that look like?
Absolutely. So as a part of our volunteerism, right, we want to have employees step out into communities, sometimes communities they've maybe never been to, or meeting and coming face to face with folks they maybe have never crossed paths with. One of the most important things to me in preparing for that is that we actually have some cultural humility training, that we actually take some time to prepare our employees for those experiences, and that we don't take for granted how those initial interactions can have such a major impact on the folks who are coming to receive service, and ensuring that they're able to maintain their dignity and that we're respectful to them, and that ultimately we're providing an experience for them, a positive experience for them. This actually dates back to a project I worked on when I was in graduate school. I actually worked on a similar sort of experience in a slightly different setting. I was creating an intervention within Black and brown barbershops and using healthcare professionals as volunteers in these shops. And we knew that most of the time, you know, perhaps a young white male who's in medical school has probably never stepped foot into a Black or brown barbershop. So in order to prepare you for the culture of those spaces and to ensure that we are not making people uncomfortable in the spaces that are already inherently theirs, I created a culture of humility training and ensuring that we were talking about the history of the barbershop and the Black barbershop and what it meant to Black men and what it meant to brown men as well, taking that same lens and applying it to this particular partnership is kind of the same thing in mind. So we actually want RAM to tell us about some of the communities that they have been in, to tell us about the culture there, to tell us how we should show up to ensure that we are providing the most welcoming and inclusive experience for those who are coming to receive care.
And so this training, this is for the Takeda employees and the volunteers, or mostly the Takeda employees who are going in?
That's actually up to RAM. So RAM has the opportunity to create this. We're asking them to create it specifically as a volunteer sort of orientation, if you will, specifically for our employees to participate. But hopefully it's something, and I think they may be interested in holding on to it as sort of a core first step for anyone who may want to volunteer for their clinics, and just ensuring that we're always understanding that there's more to learn when we interact with new people. And that's really the foundation of that.
I wonder, then, do they then take this information? That if you don't have information on that, that's fine. But I'm wondering, do they then take this information and what they've learned in their experience, do they then bring that back to Takeda and apply that to their daily activities, their work activities?
That's exactly it. That's exactly it. So my thought is that the long-term thinking here was that first I said, how can I this was a challenge for me. It's also why I was so excited about the position, because it's one thing to talk about health equity in a vacuum or around people, other public health people who get it kind of intrinsically. It's another thing to be in a space with people who understand healthcare, but maybe have never heard of health equity. How do I explain this in a way that articulates the urgency, that articulates how complicated and complex it actually is, articulates the way it's connected to other systems of oppression, experiences of racism and other forms of discrimination. And how do I like wrap that up in a bow and not get too wordy about it? That's a hard thing to do. So I started, as I had all these conversations with people internally, I really started saying, I think I could just show you better than I could tell you. So the idea is, if you have this experience, and people remember experiences, they don't remember, PowerPoint presentations and town halls, they remember experiences. If I could curate an experience that illustrates the social determinants of health, that illustrates health inequities, that illustrates the ways that systems of oppression have a deep impact and generational impact, in fact, on health outcomes for people, that will stick with you in a very different way than if I tried to give you an academic paper about it.
Right.
Hopefully then you take that back to the work stream wherever you work, in the commercial department, in R&D, and patient access. You take that back, and then you have a frame of reference when we're talking about patient X somewhere who may access our medications. You have an idea of some of the other barriers and challenges they may be trying to navigate. And now maybe you think about, okay, how can I work with what I have, work with where I am, and make this an easier situation for this patient, because I've seen how inequities actually come to life.
I'd be curious to see, this is not really a question, this is a comment, but I'd be curious to see down the line how this affects, because clinical trial disparity, a lot of Black people, a lot of brown people, a lot of Native people are largely left out of clinical trials. They're just not even asked about it.
Yes.
I'd be curious what effect this has down the line on creating more equity in that space. That would be interesting to see down the line.
It's absolutely something I'm thinking about. And as this is just the beginning of what we see to be long-term relationships. And I always, am thinking very long-term, I think into the future, which is also good, but also backfires sometimes. So I'm thinking far into the future. And that was one other thing I was thinking about, right? So after establishing a strong relationship here, and after showing ourselves as a true and trustworthy partner, are there opportunities then to start sharing more information just about what clinical trials are with some of the folks who come to these clinics? And it's a very elaborate day, a very elaborate weekend actually for these clinics. Thousands of people show up. They spend a lot of time in registration lines and things like that. What would it look like if we made use of that time and actually just started some basic understanding and education around what clinical trials are? So not even asking you whether or not you consent to be a part of clinical trials, but just let's talk. Have you heard of a clinical research study? Do you know what that is? Let me tell you a little bit about it in case at some point in your care history, it's something you might want to consider. This is what a placebo is. This is what randomization means. This is what phase 1 through phase 4 means. So doing some just very basic education on even just the language and vocabulary we use in clinical research as a foundation for really starting to build up our very dire need to diversify clinical trials, which not only includes racial and ethnic diversity, but also includes like the need for folks from rural areas, the need for folks from lots of different parts of the country and lots of different walks of life, including the LGBTQ plus community and so much more.
Can you talk just a little bit about what kind of, so I know that RAM does medical and dental. Do they do women's health and breast cancer screening at all?
Yeah, so I'm actually not sure about in depth how deeply they go. I do know that in every site they set up, they work very closely with the community already on the ground. So they work closely with like the public health department and maybe free and charitable health clinics, and really try to showcase the local resources that already exist. And that's also something I really loved about RAM is that, they already see the value in communities that are there, and see the value of the organizations in communities who have been on the ground trying to make things better for decades even, right? And so the goal of RAM is just to come in and help further amplify those efforts, and not to totally overshadow the work that so many other community-based organizations have been doing all along. So there may be some situations where they do offer those types of screenings because of the partnerships they're able to make on the ground in those local communities.
Wow. So you talked a little bit about Xavier University. I know that you provide scholarships. Does Takeda have any other partnerships in the works with the goal of addressing health equity?
Well, it's a great question. We are along our road of getting started, and I think there are.
Great start, by the way.
Oh, thank you. There are so many other initiatives and so many worthy organizations out here. I will say that we have a whole separate arm in our philanthropic giving, and our philanthropic giving is also, we have pillars that are impacting the social determinants of health around food insecurity, and around education, and around environmental change and environmental justice, and sort of climate change there as well. So we're constantly evaluating the ways that we can be of most help, and the ways that we can strategically ensure that we're really working to address inequities broadly across the population. So not just clustered in one part of the country, not just clustered within one demographic, but really how are we making our commitment to health equity known across the entire country.
Yeah, that's really important, because I speak to so many people, and whenever you say diversity, the first thing that pops into their mind is Black. And it's like, no, that's not all there is. There's women, there's LGBTQ, we're very marginalized. There's the rural community, as you talked about. There's the indigenous community. Just such a broad array of people and populations who've largely been outside of the conversation.
Yes.
So that's, I'm just grateful that you said that, and that you highlighted that.
Thank you.
Dr. Lauren Powell of Takeda, thank you so much for your time. Thank you for your efforts. And I'm really looking forward to see what other relationships you create down the pipeline. And I'm really excited to see what happens. You planted a seed there as far as the clinical trials becoming more diverse, and I'm really excited about that. So I'm looking forward to hear more about that in the future.
Thank you so much. It's been a pleasure to join you. Thank you for the invitation.
Thanks for listening to Urban Health Weekly today. I hope you'll join me and my friends next week so you can stay informed and inspired to take control of your health. See you next time.